Welcome to this presentation on client records. In this learning, you will learn what SOAP notes are and how to write your treatment notes for your clients. And you'll also learn about how to store and destroy client information. The evidence you need to provide within client records. It is important to keep accurate and confidential records to protect both yourself and your clients. You should provide evidence of a duty of care, which is how you've demonstrated a duty of care within the judgments you've used to support any of your professional actions based on your treatment, home care, and communication with your clients. Next is scope of practice. How have you kept within your scope of practice, so within your realms of a level 3 sports massage therapist, within the treatments and advice you've given to your clients. So it's about staying in your lane and referring if you can't work with that particular client if something is a cause of concern or potential contraindication. Informed consent. You must keep a record of the informed consent from your clients, which is really imperative you do before any treatment takes place. Progress. You need to keep a record of your client's progress during the course of their treatment and the desired results that are or have been achieved. And this happens or needs to happen after every single treatment has taken place. And lastly, professional competence. You need to bear in mind that you may be required to transfer your client notes to third parties, such as other health professionals or your client in the event of an insurance claim. So your client records need to be accurate, well presented, and provide enough evidence that you are competent enough to support and to perform your role.
SOAP. When creating your treatment notes, the SOAP approach is a really simple approach to note taking and is used by many healthcare professions. So it's a good thing to use if you need to refer your clients onto other clinicians, as they will also use a SOAP approach. So SOAP is an acronym and it stands for subjective, objective, assessment, procedure and plan, and we'll go through each section separately. Subjective assessments. These are the data and facts that you take from the client. This will detail any previous injuries, surgeries, illnesses or contraindications as provided on your consultation form. But it also details the problem itself, so the location, the onset, so where it started, and if there's any referral pain, the duration, the frequency and the intensity of the problem, any aggravating or relieving factors, so what makes it worse, what makes it better, and any of the treatments that they may have had. This may be seeing other healthcare professionals or clinicians. There are a few ways that you can apply your subjective assessments to your sessions. The first thing is to create an online pre-screening form to collect the simple facts and data from your client. Things like their name and address, the yes/no answers to the contraindications. And what this does, it saves time before you see them in the first appointment, so you can really spend the rest of the time focusing on about them and what's happening in their body. But also it helps qualify them to make sure that you can actually work with them, as if they have a contraindication that you need to get further assistance on, or they need to get some extra help by going back to their GP or another clinician, you can send them straight away. In terms of the face-to-face screening, this is the time that you really find out about your client and what is happening in their body. So you use those open-ended questions and use the body map to really get to know them. This is where you spend lots of time listening and you don't really say much. At the end of that subjective screening, you want to find out what your client's goal is. So questions like, what would you like to achieve out of the session? Or how would you like to feel? So you really understand the main reason why they're seeing you today, because that's what you always want to refer back to, achieving their goal. One example might be they might come in and they are experiencing upper back, neck and shoulder pain, so the back of the neck. And they're talking to you about this pain here, and then as you're thinking, so it might be some tightness in the chest muscle causing that. But then if you focus your session on just working on the chest and not working on the muscle at the back of the body, then they don't feel like they've been listened to. They probably won't come back for another session. So this is a time you can really find out what they want, and then use the objective assessments to find out what they need, and then educate the client and talk to them about the two. The next one is objective assessments. And this is the observations of your client that you make as your client enters into the room and onto the couch. So as they walk in, you might look at how they walk just briefly as they come into your clinic. It's always a good idea to walk behind them as they enter the room, so you can start to make those observations as soon as they come in. How are they stood? Are they holding one particular area? What's their posture like? Just generally before you go into the full assessments. And it also includes palpation, so the area of the tissue that you're going to be feeling. Does it feel hot, cold? Is it restricted? What's going on in the tissues? That's your objective assessments. Then it's the main assessment area. And these are all the different assessment protocols that you will use with your client. And these may be range of movement assessments, gait analysis, posture assessments, and any functional movement tests. Here is an example body map for your objective assessments. So you can ask your client to point to and shade in where hurts. Then you can also use this as you do your standing posture assessment and gait analysis to note down what you're seeing and what you're observing with your client. And lastly, this is the procedure and the plan section. So your procedure and plan refers to the treatment plan for the massage that you're going to give the client during the session, but also the homework that you'll prescribe. This may consist of the techniques you wish to apply to each part of the body and why, and always refer back to the assessments. So you always have a why to using specific techniques on certain areas of the body. The next one is what you actually completed in your treatment and why, because when you're massaging, you might realize that there's other areas you need to be focusing on. So you want to make sure that your client is aware, so have that informed consent, but that your plan that you initially made for treatment may change as you're working with your client. The next is any homework exercises that you've prescribed to your client, and again, the reasons why. Any further information or advice given to your client, so any remedial support, any further stretches, or just advice. And any notes for the next massage appointment. You may not have time to go through all areas that the client has requested, so you might make some notes that you need to focus on certain areas, or just things you need to reassess and retest in the next appointment.
Recording treatments and storing information. Recording treatments. All information that you record should be accurate, unambiguous, and completed in an eligible format with any alterations initialed. So it needs to be accurate and complete at all times. It should be completed within 24 hours of the treatment, kept confidential, and stored for 8 years before it's disposed of or destroyed. In the case of working with children, you need to keep records for 5 years after their 21st birthday. For terminally or seriously ill client records, then they should be retained indefinitely. Storing of information. If you are using a paper-based note system, information should be stored in a locked filing cabinet as hard copies. Information that is stored on a computer needs to be password protected with regular backups and really good firewall protection. If you stop using your computer to hold client information, this information must be professionally wiped from your computer. And if you are retaining client data online, for example, using a cloud-based system, then you need to register with the Information Commissioner's Officer, the ICO, which costs £35 a year. And if you Google Information Commissioner's Officer, you'll be able to fill out the form online and it will tell you how much you need to pay. And then you can do everything online from there. Destroying of information. When destroying data, all data needs to be destroyed securely by shredding and then disposing of in a secure manner. If you stop using your computer to hold client information, it needs to be professionally wiped, and any hard copies must be destroyed in line with the Data Protection Act by using a registered shredding company.